Mhm.
Awesome. Welcome, everybody. This is our second podcast, and on this podcast, we'll be discussing um, the intersections of COVID-19 and race. So, Lisette is going to start us off.
Yeah, so hey everyone, my name is Lavette. So we wanted to draw a connection between two forms of like articles. So the first one is the Coates article that we had in class, Racism and Race. So the quote is, whiteness and blackness are not a fact of providence, but of policy, of slave codes, black codes, Jim Crow, redlining, GI bills, housing covenants, New Deals, and mass incarcerations. And so we thought that that quote had a lot of significance because it highlights the fact that Blackness truly is created through in America through policies. And we see that a lot in the medical system through the policies that are created, because we see that the relationship between white people and Black people within the medical field really form the relationship where Black people are devalued and dehumanized. And we can also see that within COVID through the fact that Black people are disproportionately impacted by COVID-19. And so Mayo Clinic actually did a lot of research and created an article titled, "Why Are People of Color More at Risk for Coronavirus Complications?" And so in the article, it says research increasingly shows that racial and ethnic minorities are disproportionately affected by COVID-19 in the United States. And a piece of evidence in this article says non-Hispanic Black people and Hispanic or Latino people were both at 4.7 times the rate of non-white people to be affected by COVID-19. And it goes on to say that essentially these groups of people were more within essential worker conditions. And so they're more exposed, as well as they were more in close quarter conditions and things like that. So if anyone else wants to go off of what I just said.
Yeah, I think that's definitely like something maybe not everyone thinks about is how like I know last time you talked about how like in the medical field there's already a lot of racism, but then how like other things come into play to create like the disproportions, like how Black people are more likely to be essential workers or live in close quarter conditions, or like um I like how you brought up the quote from Coates too, because it shows how like historically like all of those things have built up through like the history, um like right now during coronavirus, some people, like if white people have like the generational wealth like you mentioned, like you know they might get the option like, oh, like it's not that safe to go into work, so I'll just like take a few weeks off or something, but not everyone has that option.
Mhm.
That's true. I'm sorry, Lavette. I was texting somebody named Lisette before you, so
All
that's
good.
why I messed up their name. But going off of that, I think it's interesting that um, so our lifestyles or our biology is more than just the genetic makeup of our body. So with that being said, it's more like the environment and the experiences in which we have as humans in life determine more of things like our exposure and infection to coronavirus. So it's interesting that um, once it becomes once it gets down to race, we kind of forget about our environment and the experiences that we have in that environment, and just focus on our um, human genomes. So that's an interesting take on why we always think that it has something to do with race, as in like our genetic makeup, when it really comes down to our environment and experiences in our environments, in which you guys were just explaining.
Yeah, I like that, and that kind of ties into what Lavette was saying originally, with kind of like with Coates, kind of like the environment creating race, like racism creating race. And as you said, there are so many studies that have gone to show how our environments have biologically changed, like our beings, you know. And I mentioned it, I think, in our last podcast, so I'm not going to go too much into it, but we even see it with, you know, in certain communities, the birth rates, or like how, you know, Black newborns are more malnourished than their white counterparts, and so on and so forth. And so I think we don't understand that, like, the racism that goes on within, like, our communities are affecting our race, and not like in turn. Like, I don't know if that's what you're saying. Like, it's like, it's not really like, oh, Black people are dying like at disproportionately higher rates because, like, they're Black. It's because of what's happening, you know, around. And so tying that back to COVID, we see that with even the vaccine, like, who's getting the vaccine first, you know, which communities are getting it first. Like, as of now, it's the healthcare workers and then the elderly, but after that, who's gonna get that first? And I was checking the CDC website, and it says that Black people are 2 times more likely to die from COVID. And non-white Latinos are 3 times, almost 3 times more likely to die from COVID. And so I think it's really important with what we're all saying, that, like, racism is really big on not just the race, but like how our community and how society is adding on to those factors, if that makes sense. So yeah.
Yeah, and just to go off what you said, so I found another article by kaiserhealthnews.org. And so it's really interesting because basically it's saying how Black Americans are getting vaccinated at lower rates than white Americans. And it's interesting that that's the case because essentially Black, Hispanic, and Native Americans, both of those minority, or all three of those minority groups, are dying from COVID at nearly 3 times the rate of white Americans, but they're getting vaccinated at such lower rates. And just to give like more statistical numbers, 1.2% of white Pennsylvanians have been vaccinated, but only 3.3% of Black Pennsylvanians have been vaccinated. So it's like really interesting, like the gap in like equity that we're seeing here, but like such drastic like gaps in like the death rates. But it's also interesting because when we think about things like the forced sterilizations of like Black women in history, where like if you all have ever heard of the Hospital 180, where it was literally put in where Black parents were forcibly like incarcerated if they were given birth to if they gave birth to an illegitimate child, or the Tuskegee syphilis experiment, which I'm sure we all know because we talked about it in the last one, where a lot of Black and minority communities are fearful of things that have to do with the medical system. It's kind of confusing, like whether the Black and minority communities are fearful of the medical system, or honestly, if this is just all happening kind of in conjunction, like what like the racist medical system and like this fear that is like rooted in Black communities, if that kind of makes sense.
No,
That makes good sense. I was actually going to ask a question before before you started to talk again. The question was related to vaccines and the spread of vaccines to people. And so my question was, do you think that it's an actual fear that African Americans have because of the numbers that they hear about, as in like COVID-19 disproportionately infects them at higher rates than everybody else? Or is it them think, or I'm trying to say that like African Americans believe in that false notion of that it's a genetic thing that results in them being infected more. Does that make sense? Is it fear, or is it them believing the false notions of their genetic makeup being the case for why they are infected at higher numbers.
Yeah, I get what you're saying. I don't think it's the fear of, that the false notion that it's genetic. I think the Black American community is very aware that it's not a genetic thing and that it's simply just like anti-Blackness. And you see that in, I don't want to misquote it, but I think it was some job that it was mostly Black Americans, and they were being paid to get vaccinated. Like they're like, we will pay you to get vaccinated. So I think it's that. I think it's not the like, oh, there's something about my genes, because back in like the 30s, they were doing studies that my genes are more successful.
Right.
What I'm trying to say. My list doesn't let me say certain words, but I think it's the fact that why are you paying me out of all people to get a vaccine? Why isn't this vaccine in my neighborhood? Why isn't, it's trends. I feel like Black Americans are not catching on to trends, but they're using patterns and trends from the past and trends that we see today. And it's like, something, I don't trust that, So I don't know if I'm answering your question, but no, I do not think Black Americans think it's a genetic thing. Like, I'm genetically Black, therefore I'm dying, at a higher rate. I think it's their patterns that have showed me that my people have not been carefully taken care of when it comes to situations like this. And therefore I'm scared and I'm fearful to fall into a trap again or become, history repeats itself. I don't know if that answered.
No, that answer. So what you're saying is basically it's a lack of trust in the medical system.
100%.
As that was saying.
Yeah. 100%.
Yeah, makes sense.
Yeah, I think that definitely makes sense too. And then something else I was also thinking about is like, at this point, I think it's like common knowledge that like just about everyone knows that Black people are like disproportionately affected by COVID. And like, even when I was like looking up some things about it, like there were so many different sources that said it, but like, I don't know, what is that doing? Like, everyone knows it, but it seems like no one is like actively trying to solve the problem at all, which is interesting, I think.
Well, I wouldn't say that, because I think that people are actively trying to like dismantle, and I was gonna actually ask a question, but people are trying to actively like dismantle like the exploitation of like Black and minority groups. Like because I don't want to erase like the work that like Black doctors and other like doctors are doing in order to like uplift like rural and like minority communities. Like there's a lot of like research that's going on with like racial disparities and healthcare disparities. Like at the Cleveland Clinic Minority Men's Health Center, this is kind of like research that I do and like volunteer work that I do. Like there's a lot of doctors that work with researching ways to like implement a lot of different healthcare initiatives and like so this is kind of like what I want to do. So like that's why I'm kind of like gonna go on a little bit of a tangent, but like there's a lot of work that's being done in order to like make sure that like we can dismantle like the white supremacy that's going on, like that's deep rooted in healthcare, like in OBGYN and urology. Like there's just so much that's like deep rooted in like healthcare, but there's work being done. I'm not a doctor, so I'm not about to like talk about it like I know about it, but like I don't think that we should like erase the work that's being done, but it is definitely deep rooted, but I don't think like erase the work that's being done.
Yeah,
like,
definitely.
But I was gonna ask, like, do you all think that with the work that's being done, like I know like over the summer, there's like a new trend that's going on with a lot of medical schools called like White Coat for Black Lives, where a lot of schools like have responded by like implementing a lot of like education about like it's called like they've implemented a lot of like what is it called? Like basically just more like awareness for like racial inequity and like as I go through like the application cycle for medical school, like basically like they're trying to educate more doctors about how to understand more of like racism and implicit biases and things like that. So do you all think that that is actually going to help like what is all of your opinions? Like, do you think that this will actually help minority communities and like and such?
Mm.
Like, do you think we can dismantle this system essentially and reverse
I
this?
think that this is going to sound very Afro-pessimist, but that's because it is. But I, I think that yes and no. Oh, there's no way you can argue that having these systems in place will not help, but to what extent? And I was reading this book, I think I have right here. It's called The Chokehold, Policing Black Men. And in it, they talk about like the under and over policement, under over enforcement, and how like at one point in like the late 80s, I want to say, they were trying to put a lot of Black police officers into the force in order to help with the police brutality. And as we can see, it hasn't done much. It probably did something. So when I think of this, I kind of think of that standpoint where like, of course, there's so like the percentage of Black doctors are raising drastically, and it's beautiful, you know, especially with Black women. However, there's only so much they can do in a system that's also restraining them, you know. And I don't know if you heard about it, but there was a Black doctor that was fired from like the board of something because they started to get less white applicants. So I guess what I'm trying to say is like, I think it's helping, but to what extent? Because there's only so much a Black person can do, even within the field, you know, within the center of that. So it's gonna be a struggle, but it's better to make an inch, you know, than nothing at all. So yeah.
Just to say something really quickly, your question was, do you think that raising awareness will dismantle a system, correct?
I guess just like I mean, yeah, kind of like the way that doctors are implementing like knowledge for like these racial injustices into like their curriculum for new upcoming doctors, research about healthcare disparities, things like that. Like, yeah.
Yeah, I see. I think it's a good step. I'm not saying that it's not a good idea, but I think it's a good step into raising awareness, but I don't think it's enough into create real and genuine change that is long lasting. I think this is a very short term thing, even though it's very great that they're doing this, but it's very short term. And before we even know it, we will have to think of something else to push us forward as a human race, if that makes sense.
Mhm. I like that. Yeah. So I know we're really, really short on time, but I have one last question. Like one person can answer this. So what do you think? Because I do agree 100% that it's very short term. So what would a long term like system look like to actually make change that isn't like sporadic and almost like trendy?
I think that I think that if we use policies in order to create race, we'd have to implement policies in order to dismantle it, like in the same way. So I think that we would have to use like the same legalities, like, and actually enforce it within like laws, and actually like I think it would have to be up to like the federal level, like, and we'd have to create like actual like social and like political like backing that supports the Black people in the same way that it supports white people. I think that's the only way that we would ever value Black people, like, because I think that like Black Lives Matter as a movement, like as a hashtag, like only like has it only carried that much weight because of the value that we gave it, but like it really didn't have that much weight like at the federal movement. It had that much weight on Twitter, but like not, but it didn't really have that much weight. Like, you know what I mean? Like I think that if we really gave it that much weight in policies, then I think that it would really have like long lasting, like generational change. So yeah.
Great.
But that's all the time we have. Right? Or does someone else want to answer with us?
No,
No.
I think
No.
we're good right there.
Mhm.
Okay, so that's all the time we have. So thanks for watching. Bye.
Bye, everyone.
Bye.